dude.
That's it. What's up, guys, to another episode of Nursing and Flow. It's your boy Stevengoingham RN with special guest Fit Nurse Autumn. And we're going to be talking about how to balance life and nursing school. Welcome to the episode. So Autumn, tell us a little about yourself and what inspired you to pursue nursing.
So I'm Autumn. Right now I work at a hotel. I work about between 28 and 32 hours a week, just depending on the workflow. I'm currently a nursing student at Nevada State College. I'm in my 6th out of 8 semesters. So right now we're rotating in IMC-ICU. I'm also transitioning to a new job, which I'll post about soon. So what inspired me to pursue nursing? So as a nursing student, you get asked this question at least once a week, all the time, like, oh, why do you want to be a nurse? Why do you want to be a nurse? And to be completely honest, I had no idea until like my 3rd semester of nursing that I was even going in the right direction. Right. I just always knew, hey, I was really good at giving a crap about people. I was really good at caring for others, and I was really good at science. Those are my 3 main things. So last year, unfortunately, my mom was diagnosed with breast cancer, and you know, it was a really huge whirlwind of emotions. It was, oh my gosh, like, what's gonna happen? Does she need chemo? What's the next step? So ultimately the step was that she had to have a breast removed. So thankfully I had gone through my skills courses. I had gone through all of my basic nursing skills needed to be like a nursing assistant at least. Come my 3rd semester, I was able to help my mom bathe after her surgery. I was able to help her regulate between like a stool softener and a pain pill and understand the difference of what chasing pain was like and just staying ahead of it and things like that. Like I was telling Christian before we started, I didn't really know that I was in the right spot until this very moment. Like, when you have somebody that's gone through something traumatic like that, which is a lot of our patients that we're gonna have been through something traumatic, being able to hold their hand through it is really important. And that's why our jobs as nurses are important. So this exact moment is really what told me that I was in the right place. Was, you know, 3 days after surgery, typically you're able to remove bandages and kind of inspect the site and make sure everything looks infection free. I think my mom had surgery on a Thursday. Come Sunday, it was time, hey, like, let's get you showered, let's wash your hair, help her feel a little bit better with some camp therapy, maybe some scented lotion. We didn't think it was gonna be a big deal until it actually happened. So we were getting her ready, I had the water on, and we had taken her bandages off. And I don't think I'd ever seen my mom so completely heartbroken in her life. It was absolutely heartbreaking for me, for her. But in that moment, it was really important for me to be able to hold her hand, and I was able to kind of connect it where it's like, I don't know if you believe in God or some sort of higher power, but that's kind of what told me, hey, like, you're in the right place. You know, this is your job, is to feel heartbroken on behalf of somebody else and to be able to do so gracefully. So I felt like, you know, it's my job to be able to be heartbroken on behalf of somebody else and be able to take that and still care about them effectively, if that makes sense.
Awesome. So my second question for you, what has been your favorite subject so far in nursing school? And do you happen to have any idea what type of specialty that you want to get into once you graduate?
So far, my favorite subject has been pharmacology. I know a lot of people probably say that, but because every single semester you're going to learn about new medications, but the foundation that you get in pharmacology is so important. Just knowing like the prefixes and suffixes of each medication is really important, and it'll help you to know, like, hey, oh, my patient is on this type of medication. They might have this type of problem wrong with them. Maybe this is how we can help them. Specialty wise, I had a teacher at Nevada State that used to be a flight nurse, and he was telling me about it, and that's definitely the type of specialty I'm most interested in. So anything critical care related is really interesting to me.
Excellent. As your social media name suggests, you're Fit Nurse Autumn, you're into fitness and nutrition. How important is it for you to incorporate a healthy lifestyle, you know, while being in nursing school?
So as a nurse, inherently, we are programmed to be able to deal with really stressful situations. What I've learned personally, and everybody's different, but what I've learned personally is that I get really bad anxiety sometimes, and being able to deal with it comes from having a really healthy mind and a healthy mindset. So how I combat that is with fitness and nutrition. I've noticed on the days that I don't eat so well, or on the days that I didn't get a chance to go to the gym, I feel a little bit more jittery and a little bit less sure of myself. So working out kind of gives me endorphins and the confidence to kind of go about my day and be mentally strong to be able to think logically through those really stressful situations.
So you practice self-care, you work out, you have a part-time job, I understand, you told me about that before we started, and you're studying to become a nurse, all three. So how the heck do you manage to balance all three at the same time?
So being completely honest, it's unrealistic to think about every single one of those things at the same time. The way that I go about it is just doing one thing at a time. Every Sunday, I mean, of course, depending on what your due dates are for school, every Sunday I look at what I've got for the week and I just take it one day at a time. It's unrealistic for me to eat healthy every single day. It takes a lot of self-discipline, which I like to think I have some of, considering I'm learning to be a nurse, but realistically, I mean, there will be a day where I'm like, you know what, I want some French fries today. Because I'm a stress eater, I'll admit it. Like while I'm studying, I will stress eat and snack as much as I can and want to. But the fact that, you know, I'm able to go the next day and say, okay, it's time to get back on the ball. Like I didn't go to the gym yesterday and I ate like crap. Let me go ahead and get back on it. So being able to balance it is really difficult, but you know, even when you fail at it, like, oh, I didn't go to the gym today, the fact that you went back the next day is what's the most important. Like, ever since I hurt my shoulder, I've only been able to go maybe 4 times a week. Otherwise, it gets really inflamed, and I still have to be able to protect it for at least another month before I start lifting again overhead. So just the fact that I'm like able to discipline myself in just one day at a time. Like, hey, how do I feel today? If I'm feeling like I'm hurting, I'm not gonna go to the gym, but I'll be able to study more. So it's just being able to recognize how you're feeling about that particular task that you have for the day.
You know, I completely agree. Like for me, like I try to incorporate fitness as well as much as I can while at work, and it's very hard, especially as a nurse. You know, you're working 3 days a week, 4 days off. It's very easy to kind of skip the gym and forget about fitness, self-care while you're working your 3 days of a week while being a nurse. But during the 4 days, it's also important to, you know, to get out there, you know, practice self-care, nutrition, go to a fun trip or something like that. And when you're taking care of yourself, it's going to make a huge difference in your role as a nurse, even as a nursing student, because not only do you feel better, but you're also, you know, you feel like you're refreshed, you're ready to go, and that, you know, you're ready to take on whatever obstacles in front of you. So respect that about you, Autumn.
Yeah, absolutely. Thank you. And it's like, of course, I've noticed this too, like at clinical, on the days that I don't really exercise and haven't been taking care of myself, I'm a lot less sure of myself. I'm like, oh my gosh, I don't know if I'm doing this right, or I've got a pretty foggy brain because I'm really exhausted from getting up at 4 o'clock in the morning, which is totally normal, but it's like when you're rested and you're eating well, you're more confident overall. I feel that way anyways.
I feel that way too. I 100% agree. So last and final question, Autumn. Probably asked this a lot, but what is the biggest piece of advice you would give to someone that just started out nursing school?
So being almost finished, thank goodness, being almost finished, my biggest piece of advice is always going to be just take it one thing at a time. Whether it's, I mean, in nursing, sometimes it's 1 hour at a time, 1 hour of 12 hours. Okay, what do I have to do within this hour? What meds are due in this hour? But as a student, it's just take it one day at a time. And of course, just understand like what your limitations and shortcomings might be as a student. And don't be afraid to ask questions. I know that that's going to be said, you know, a million times over, but don't be afraid to ask questions, even if it's in your study group. Definitely find people to lean on, because nursing school is a team effort. Like, although you have individual grades and individual work that you have to complete, you have to have those people to lean on, because nobody knows more about what you're going through than people that are going through it with you. So find your friends.
So who would you say would be like your biggest like support system right now in nursing school?
So in nursing school, I've had several different types of support systems, and I'm grateful for every single one of them. I have my best friend, Ben. Shout out to you. We sit there and, like, you know, I've got my friends Ben, a couple of others in our class that will sit there for upwards of 6 to 12 hours and study. And it's like, hey, you explained that incorrectly, I'm gonna correct you, and now moving on. So, you know, being able to admit when you're wrong. Of course, my parents have always been there for me. You know, there's no way for me to really explain to them how stressful nursing school can be, just trying to tell them about it. But again, you know, everybody has a different threshold for stress. So my parents were super supportive. Of course, my boyfriend, he understands. He's a
Yeah.
paramedic right now. He knows what it's like to go through school. So just him being understanding and helping me with household tasks has been super helpful. And then of course, like, don't be afraid to lean on your teachers too. I've had a couple of professors where I've been able to email them late at night, like, hey, I don't understand this, can you please help me? And if they're up, they'll take the time to help you. Or, hey, like, I don't understand why I got this question wrong on the test. They'll either explain it to you, or if it's an actual question where, you know, they don't think that they should have left it on the test, they'll take it off if it's an unfair question. So communication is a huge part of it. And, you know, like I said, find your friends. Those friends in your nursing program are gonna be your biggest support system. They're right there with you, going through it with you. It's not an easy thing. It's pretty traumatic sometimes.
Listen to all of Autumn's advice, and also, you know, don't be afraid to ask questions and ask for help when they need it.
And you can even message me. I get messages all the time like, hey, I'm just starting nursing school. Please feel free. I promise I'll answer you. I'm not gonna ignore you.
All right, so that's pretty much it. Is there anything else that you wanted to add?
No, yeah, like I mentioned, shoot me a message. We're gonna be doing a giveaway pretty soon. So Christian and I are gonna be participating. It'll be a pretty fun one for you nursing students and new nurses. So keep an eye out on our pages for it.
All right. Thank you guys so much for watching this episode of Nursing and Flow. Go ahead and follow Fit Nurse Autumn on Instagram. Follow me on Instagram at cmoneyrn. And if you haven't yet, please subscribe to my channel. Hit that like button, leave a comment below. And I hope you guys enjoy the future content that I will provide for you. Thank you guys for watching. Take care, guys.
Bustling through the bears that try to contain me. Moving on up, making moves of money endlessly. How you think I got this name? C Money, it's my specialty.